We've been having conversation with Bukola. She is an expert when it comes to fighting ultra-processed food contamination, including tobacco control activities, and how she felt industries are taking advantage of Africans, and our way of life has changed. Welcome. Many thanks for joining us once again, Bukola.
Thanks for having me.
Great. Now, some of the lifestyle activities that you mentioned whilst you were responding to my colleague's question, the industrialists themselves will argue that it is not as a result of what they've done that rapid urbanization in the continent of Africa is a necessity for that transition. Globalization by its own self has equally, flooded into the African continent. And these are reasons. In fact, your work schedule itself is even enough to change your activities. Why are the industrialists being blamed for this act when they are just there to provide job for the rapid growing population in Africa and contributing their own economic benefit and quota for the development and employment for the people in Africa? They will want to puncture your argument by these points I just mentioned out to you.
Yeah, definitely. So the industry obviously has its playbook, and they have implemented this playbook across different countries. And, it happened in South Africa, where South Africa was trying to implement taxes on sugar sweetened beverages. The industry came out to say, oh, we're contributing to the economy, there are going to be job losses, and then it's going to affect our national productivity and all manner. It's a playbook that we have seen play out across different continents of the world. And after, South Africa implemented taxes on sugary drinks with the justification that if you're feeding people with sugary drinks and claiming that it's a staple for the poor, and people feed on these drinks every day and it's exposing them to diabetes, obesity, and dental caries, then we're going to impose a tax on you. And then proceeds from that tax will be used to finance healthcare. Will be used for healthcare financing for the treatment of the diseases that you have caused, which is actually justifiable. After that, a lot of these industries now started moving from production of these sugary drinks into other healthier alternatives. You see, if the industry cannot go out of market because it has the free, the opportunity to move from what's not selling to what's selling now. They can diversify into other products that are now selling. If the demand for sugary drinks has gone down or the demands for ultra-processed foods has gone down, these same industries diversified into producing healthier alternatives, and they are aligned with public policies. At the end of the day, data actually showed that there were no job losses. They declared more profit. However, that was just their playbook. They apply this playbook across different countries, which we have also seen play out in Nigeria. Anytime, policies are put in place to promote healthy, healthy food policies are underway in the country, you always have industry pushback. They'll say, oh, if you implement this policy, it's going to affect the market. If you reduce salt in ultra-processed food products, it's not going to be tasty. It's going to reduce demand. But this has been data. Governments have actually also gone into researching before and after. They come with a baseline. Okay, this is where you are. After implementing these policies, we also want to see how far these policies have affected your businesses, and then they find out that it's a lie, And recently, I think Coca-Cola actually declared in Africa, they declared the largest, I think, profit share, something like that. There's a report, a recent report. If you look at it, they're even making more profit over Africa than what they used to make before, because they latch on, our poor regulatory framework. So I don't believe industry lies. They obviously have a playbook that has proven false across different continents of the world. Yeah.
And thank you very much. Now, you mentioned South Africa and probably one other country, but let me mention that of Nigeria. Nigeria introduced an excise duty of 10 naira per liter on sugary drinks in December 2021. Tax, officially part of the Finance Act 2021, applies to all non-alcoholic, carbonated and sweetened beverages. So I think Nigeria itself is taking that route. We really hope that those monies realized from the sale of these commodities will be used to build health facilities and expand our health infrastructure, not only in Nigeria, but generally in the continent of Africa. But I want to ask another question. There's a rapid boom of population, and organic foods cannot suffice to take care of these people. The existence of fast food entities seems to be solving this problem. Number one. Number two, an organization, an institution like the National Administration for Food, Drug Administration and Control, NAFDAC, is also playing its own role to make sure that there are regulatory policies to regulate this fast food industry. Don't you think they are equally doing a good job? And with the efforts of these two institutions coming together, do you not think we have actually achieved a balance in Nigeria and in Africa?
My sincere apologies. You were actually breaking through the call, so at a point I couldn't hear you. If you could just just summarize the question again, so I'll get you clearly.
Okay, so I was actually trying to tell you about the role that NAFDAC is playing in regulating these sugary substances as a government institution saddled with the responsibility to do that, and if they are not actually doing what the terms of reference of the establishment of the organization is doing. And secondly, I also mentioned that there's a rapid growth in global population in Africa and most especially in Nigeria. And organic food cannot take care of this population. Don't you think the ultra-fast food services are filling in the gap?
I actually do not think the ultra-processed fast food companies are filling in the gap. Nigeria as a country, data has actually shown that we consume more of our indigenous foods than ultra-processed food products. Like Nigerians, even in diaspora, prefer to consume more of locally available food than ultra-processed food products. So if you say that ultra-processed food products are filling in the gap of bridging the gap of food insecurity, I do not totally agree with that. I agree that there's food insecurity in the country, which is caused by a lot of factors. Part of the factors include,
No, go on.
Okay, and some of these factors actually include the high level of insecurity across the country. However, people still try to farm. Yes, we know that to some extent, even the high cost of transportation has obviously impacted on the availability and affordability of food. However, Nigerians still buy these foods. Yes, to say that there is food insecurity, yes, there is. However, are the ultra-processed foods relatively cheap also? I can remember, I think sometime 2 years ago, a bottle of sugar sweetened beverage would go for 150 naira. But at the moment, sugar sweetened beverages, the price has hit 500 to 600 naira. So they're not like a bailout as they make it look. You understand? Because Nigerians still fall back to the foods that are affordable and locally available. So I do not believe that, food industries are bridging the gap of food insecurity. This is not to say that they are not part of the food system. However, saying that they are the bailout, I do not believe that. And then you talked about regulation. Yes, in Nigeria, a sugar sweetened beverage tax of 10 naira per liter was implemented a few years back. However, 10 naira per liter is no longer effective as of today because the economic realities have changed. The value of 10 naira sugar sweetened beverage tax tax on a liter of drink is very, very low, and it may actually not help us to achieve or to even raise enough funds for healthcare financing, which is part of the reasons why CAPA is actually advocating for an increase in the sugar sweetened beverage tax to 130 naira per liter, because 10 naira is of no value today. However, if they have to pay 130 naira per liter tax on sugar sweetened beverages, money realized from it can be channeled towards treatment as well as other public health interventions targeted at tackling non-communicable diseases in Nigeria. So the regulatory bodies, of course, they are doing their job. However, we are requesting that they do more at making these policies effective. It's one thing to have a policy or a regulation in place. It's another thing to have these policies or these regulations adequately monitored and implemented effectively to yield the desired result. So our appeal is that, yes, we have this policy, we have a sugar sweetened beverage tax. However, is the tax properly earmarked to management of non-communicable diseases in the country? At the moment, Nigeria allocates zero funds to treatment and prevention of non-communicable diseases. It's not part of in Nigeria's basic healthcare package. You cannot walk into the hospital and be treated for free of hypertension. People, this has hampered on, this is a disease that actually affects the productive, population in this country. You have people from their 20s, ranging up to their 50s, suffering from either hypertension, diabetes, and kidney failure, and a lot of these diseases. And then the government, as of today, does not allocate funds to treatment and care of non-communicable diseases in the country. That's not a good place to be. This has hampered on our life expectancy, as reported. Yes,
it's
please,
less
as
than
reported
50. It's less than
recently.
50. Yeah, because I was even going there. But then
yes,
again,
this
look,
has a grave effect.
How about we nip it in the bud, right? We'll start from the beginning, because look, the problem is already there, right? And I see the advocacy. You want a tax to be made on sugar sweetened beverages, and I mean there's another campaign for front of product package labeling and stuff. Yes. So some of these policies exist, right? But how about we focus on fixing the problem from the beginning? How much of this information do people have to, for example, avoid all these UPFs and sweetened beverages? How much advocacy are done from that end so that people can know to avoid these things before you get into it and then begin to look for how to fix the health problem?
Yes. So for advocacy, a whole lot of work has gone into advocating for an increase in sugar sweetened beverage tax, as well as, limiting. For instance, last year, a national guideline for sodium reduction was launched to help Nigerians reduce their salt and sodium intake. So the government is doing so much. From that national guideline, NAFDAC is currently working on a regulation that will hold industries accountable to reduce the quantity of salt and sodium in processed and prepackaged foods that are sold on market shelves, because 75% of the salts that we consume come from prepackaged and processed foods, because you require a lot of salt to preserve these foods and elongate its shelf life. So NAFDAC had even launched, this regulation was launched on NAFDAC's website for public comments. They closed comments on the 22nd of August, and we're hopeful that before the close of this year, they may call for a stakeholder, engagement. So a whole lot of advocacy work is going on. The Federal Ministry of Health, the National Agency for Food and Drug Administration and Control, they are doing a fantastic work to put measures in place to, regulate the food environment. Of course, if we do not regulate the food environment, there's little that we can do. Furthermore, as CAPA and its through the Federal Ministry of Health, Global Health Advocacy Incubator, and other partners are also creating, raising awareness, sensitizing the public of the public health consequences of excessive salt intake, excessive sugar intake. If you go on social media, Kappa is there educating people, organizing press briefings, going on different platforms, both traditional and digital media, to educate people. This is not to say that, of course, we have reached everyone. However, work is ongoing. We are also partnering with key stakeholders in government to amplify the messaging. So it's tackling unhealthy diets would require a multi-sector approach. It's going to require different actors putting their hands on deck, not just food regulation. It's going to require mass media. It also requires incorporation of nutrition education into school curriculums. We have a technical working group that comprises of stakeholders from the Ministry of Education, Ministry of Health, Ministry of Agriculture, to also work on policies that will expand access to healthy and wholesome foods, to ensure that healthy food is accessible, it's affordable. So a whole lot of work is going on in this regard. If you want to know more.
Yeah. Right. So since the advocacy started and the policies are already there, are you already seeing positive change or positive trends since the advocacy started? And then give us your final message or word to agencies, parents, children, what people need to know, so we can get a healthy society, say, in another 2, 3, 4 years?
Yes. So I would say that, of course, we have seen positive results with the advocacy work that has been done. With policymakers, the policymakers are very receptive and they are working fast to see that these policies are not only in place but are also implemented. For industries, we have actually received industry buy-in to cooperate with the Ministry of Health to ensure that their products are reformulated to meet with set standards. You see, that's applaudable. And then with the public also, of course, we there's been ongoing grassroots mobilization, ongoing public awareness and sensitization, and people are coming to the realization. Some would say that, oh, before we thought it was only too much sugar that was a problem. We didn't know that excessive intake of salt is also a problem. So we have seen measurable change. However, we are still aiming at doing more and achieving more, not on our own, but of course through the Federal Ministry of Health that has been very supportive, through NAFDAC and other major stakeholders and global health advocacy incubators, civil society organizations. A lot. So we have seen measurable change.
Great.
So for last words,
Great.
yes,
Okay.
to parents, I would say the earlier we watch what we feed our children, the better. Stop packing unhealthy, ultra-processed foods in your children's lunch boxes, because this is a huge determinant, not only in their health, but in the quality of life that they would live, not just as children, but as adults in the near future. So it's profitable for a parent to ensure that they pack healthy, wholesome food in their children's lunch bags. To industries, of course, reformulate your products. To policymakers, kindly, of course, I said to industries, reformulate your product. Don't just reformulate your product. Put people before profits, because at the end of the day, industry actors are also members of the public. And what you put out there will affect you directly or indirectly. And then to our policymakers, we appreciate the good work that they're doing to expand access to healthy food. We also ask that they intensify work and, act faster on ensuring that these regulations and these policies are not only in place but enforced for greater results. Yeah.
Okay, thank you so much, Bukola Olukemi Odele. I would have preferred that we just continue on handing with the conversation with you, because you've been quite excellent in the way you converse and the way you are trying to argue from Kappa's perspective that the industrialists will not see that. But I dare say the industrialists are not completely wrong, but it's a good fight you are fighting. Thank you very much. Bukola Olukemi Odele is the project officer for cardiovascular health at Corporate Accountability and Public Participation Africa, a leading civil society organization focused on advancing corporate accountability and public health in Africa. She is also a seasoned public health advocate with expertise in nutrition policy, non-communicable disease prevention, and community health education. Through her work at CAPA, Bukola has led public awareness programs and campaigns on healthy diet, tobacco control, and food regulation, and has been quite instrumental to CAPA's advocacy for stronger regulation on ultra-processed foods and sugary beverages across the continent of Africa. Thank you so much for your time with us. We really had a robust conversation
For
with you.
having
We
me.
look forward
It's a
to
pleasure
having you
to
next
be
time.
here.